Hi, this is Jerry, and this is sort of like a public service announcement. I just wanted to remind everyone it is flu season and COVID booster time, and I wanted to share some very important things with you. Today, instead of going to my regular advocate healthcare doctor this year, I decided to do something different. I booked my flu shot and COVID booster through the Community Health Center, through the Chicago Department of Public Health. With a quick online appointment at the Uptown Community Health Center on Wilson Avenue near Sheridan Road, I wanted to see how easy it really was. Spoiler alert, it was one of the most painless and convenient healthcare errands I've ever done. Now, when I walked into the building, I signed in at the front desk. A kind nurse came out right away, confirmed my information, and invited me into her office. It wasn't a sterile white medical room. It was decked out in Chicago kitsch with the flag and city pride everywhere, although I had issue with the White Sox decals on the filing cabinets and refrigerators. We are on the north side of Chicago. It felt personal and welcoming, like this was care rooted in the community. Within minutes, I had rolled up my sleeve and gotten both the flu shot and COVID booster. Now, here's the best part. Through CDPH, I got both shots for free. No billing, no insurance runaround, no copay surprises, no pulling out of cards or whatever. Just straightforward public health in actions, just like how it should be across America. I sat in the waiting room for the standard 15-minute observation period to make sure I didn't have a bad reaction after the COVID shot, and before I knew it, I was back in my car just 30 minutes after arriving. Now, as someone who has worked in healthcare for 20 years and who was honored as a Crane Chicago Business Magazine Healthcare Hero in 2020 during the pandemic, I can say with confidence that this is one of the smartest things you can do for yourself and the people around you. Vaccinations. Vaccinations for flu, vaccinations for COVID, vaccinations for anything else, they save lives. The flu is still one of the top causes of death in America. Immunocompromised people count on the rest of us to reduce transmission. And let's not forget the reality of the holidays. We're all about to be surrounded by children with sticky fingers and coughs, relatives with underlying conditions, and crowded gatherings that make it easy for viruses to spread. Now, I'm going to bring up some of the myths that I keep hearing every single year in my work in healthcare or in my social circles. Number one, the flu shot gives you the flu. This is absolutely wrong. It does not. The flu vaccine is made either from inactivated virus, which is basically dead virus, or a single protein from the flu virus. Neither can cause the illness. If you feel tired or achy afterward, that's not getting flu. That's your immune system revving up its defenses. Basically, when you get the flu shot, it introduces this little protein of the flu virus, and your body basically starts attacking it, so that the next time the actual full virus shows up in your body is ready to fight it out. The next one, number two, I'm healthy, so I don't need it. Also wrong. Even if you recover quickly, you can spread flu or COVID to someone who won't. Vaccination is an act of protection for your grandparents, your neighbor with cancer, or the coworker with asthma, or total strangers that you're going to sit with or stand with in line at the grocery store or on a train or bus. Number three, natural immunity is better. I hear that a lot. Not when it means risking hospitalization, long-term complications, or death. Vaccines give your body a safe practice run, not a life-threatening battle. You can actually die from flu. Healthy people die from the flu. Vaccination helps you not die from the flu. Here's another one. I got vaccinated before and still get sick, so it doesn't work. I hear this from family members, and it's also wrong. Vaccines are not magic shields, but they make illness much less severe and drastically lower your risk of hospitalization and death. You can lower your risk of death. So it's better to be sick for 2 or 3 days versus not getting the vaccine and being seriously ill for a whole week or longer. That's what usually happens when you get the flu. Here's another one. I don't have time. I hear this a lot. My whole visit from walking in to walking out took 30 minutes. That's less time than picking up groceries or standing in line at Starbucks. Why does this all matter? flu and COVID are still here, and they still take lives. They kill people. Seniors remain at high risk. Immunocompromised people, these are people with like type 1 diabetes or people who have had cancer. They depend on us to keep spread low. And as we head into a season of family gatherings, crowded airports, and holiday parties, vaccines are our best defense. Now, if you live in Chicago, CDPH makes this easy and free. I love that phrase. If you're outside Chicago, look for community health clinics near you. Many offer flu and COVID shots at no cost, and if they don't, call your local leaders, your village trustees, your city council members, or alder people, and demand this service for the public. Public health should be accessible to everyone, not just those who can pay or who happen to live in a major city like I do in the city of Chicago. So don't wait. Make an appointment, roll up your sleeve, and take 30 minutes to protect yourself and the people around you. It's one of the smartest and kindest choices you can make this season.